So we have discussed about the beginning of modern pharmacology. In this lecture, we'll discuss about the contribution of some physiologists and some of the pharmacologists in the development of modern pharmacology. So in the early 19th century, there were no pharmacologists, there were physiologists who performed pharmacological studies, who performed some experiment, and it becomes the birth of the modern pharmacology. So who were these physiologists who performed pharmacological studies? Magendie and Bernard. These two were the physiologists. And these two were the true pharmacologists. That is your Buckim and Oswald Smithberg. And this is your Bernard and Magendie. So these were early physiologists who performed pharmacological studies. So we have the trick MBBS, where the first M and B, they were physiologists, and BS are the pharmacologists, where this Bernard was a student of Magendie, and here Smithberg was a student of Buckim. After this, more than 200 students of the Smithberg, they spread the pharmacology over 20 countries. And these are some of the students which are important for MCQ point of view. So in modern pharmacology, these MBBS will study in 4 subheadings. Their origin, for example, these two were French physiologists, and these two pharmacologists were German pharmacologists. Then the work performed by these physiologists and the pharmacologist, and the credit means, for example, this Buckim is known as father of pharmacology, and Smithberg is known as father of modern pharmacology, and this Magendie is known as pioneer of experimental physiology and pharmacology, and this Bernard credited with father of experimental medicine, and this Abel is known as father of American pharmacology. So the credit either father of pharmacology or founder of something will study in the credit portion, and this is the additional information where we'll study some of the books or some of the journal founded or book published by these pharmacologists or physiologists. So these 4 will be our subheading: origin, their work, what study they performed, and the credit goes to these 4, and some additional information like the book they published or founder of any journal or any society. So first we'll start with the 2 physiologists, Magendie and the Bernard, where Bernard was a student of Magendie. So first we'll start with the origin of these 2, their work, their credit, and their additional information. So first we'll study Magendie and the Bernard. Both were physiologists who performed pharmacological studies. Both, their origin was, they were French physiologists. What work they performed? first of all, Magendie. He developed so many experiments to elucidate or clearly signify the concept of physiological processes and action of the drug in the body. So what he did, he studied the IV effect of intravenous effect of these drugs like ipecac, strychnine, quinine and morphine. What he demonstrated after injecting the strychnine, he demonstrated site of action of the strychnine, which was spinal cord, where it inhibit glycine receptor. And what he demonstrated, that once we inject something like subcut or intramuscular, these chemicals, ipecac, strychnine, quinine, morphine and many others, these chemicals, they absorbed into the vascular system, which was discovered by William Harvey to exert their systemic effect. So these were the studies and demonstration of the Magendie. Then Bernard demonstrated the site of action of the drug tuberculare, or which is also known as arrowhead poison, the poison which was applied over the arrowhead poison. Its site of action was neuromuscular junction, and this chemical curare act at the neuromuscular junction and paralyze the animal. Second, what he studied the effect of carbon monoxide on hemoglobin. Number 3, role of pancreatic juice in digestion. Number 4, liver glycogen and its importance. Number 5, regulation of blood vessels by vasomotor nerve. What kind of regulations? Either they dilate, vasoconstriction or vasodilation. So these were some the experiment or demonstrations or studies performed by the Bernard. So after their origin and the work they performed, third step is the credit. Magendie is known for pioneer of experimental physiology. These are 3 different MCQs. Pioneer of experimental physiology, Magendie. Pioneer of experimental pharmacology, Magendie. Pioneer of experimental physiology and pharmacology, that is also Magendie. He established foundation of modern pharmacology. He initiated the science of experimental pharmacology. So these are the credit or MCQ for the Magendie. Bernard, there is one MCQ, father of experimental medicine. And what is common in these two is both practiced vivisection, that is they dissected live animal without giving them any kind of anesthesia. That was a kind of animal cruelty which was opposed by some society person. And additional information about Magendie, he published formulary of Magendie. He published one formulary that is known as formulary of Magendie. In total 8 editions from 1821 to 1836. So this is all about the Magendie and Bernard, who were the early 19th century physiologists who performed pharmacological studies. So after Magendie and Bernard, Rudolf Buckim and the Oswald Schmidberg. Oswald Schmidberg was a student of this Rudolf Buckim. Both their origin was Germany. They were German pharmacologists, not physiologists. And the work they conducted: hypnotic effect of chloral hydrate, and Schmidberg, hypnotic effect of urethane, that is urea derivative urethane, an anesthetic we normally use for lab animals in previous days, that is the urethane, and paraaldehyde. Then he introduced bioassay, and he conducted so many extensive research to elucidate the action of the drug in the body. If he could not demonstrate the action of the drug in laboratory, then he deleted or destroyed that drug or remedies. Oswald Schmidberg studied the effect of muscarine, atropine, nicotine, and digitalis on cardiac muscles, on the heart muscles. He demonstrated that muscarine had similar effect, that is equivalent to electrical stimulation of the vagus. Means the vagus nerve releases acetylcholine and the muscarine, they both had similar effect, that is decrease in the heart rate. So muscarine versus electrical stimulation of the vagus. Then the credit goes to these two pharmacologists. Credit goes to these two pharmacologists. This Rudolf Buckim is known as father of pharmacology, and Oswald Schmidberg is father of modern pharmacology. So remember the word modern pharmacology. He was the first professor of pharmacology in the world. He was the first professor of pharmacology at the University of Dorpat in Estonia. This Dorpat, at present it is known as Tartu. He was the first professor of pharmacology at the University of Strasbourg, and he is known as the originator of the pharmacology. And Oswald Schmidberg was a great teacher of pharmacology, and he was a student of Rudolf Buckim. His thesis work was on quantitative measurement and the fate of chloroform in the blood. Additional information about these two. First is Rudolf Buckim established world first laboratory of pharmacology. World first laboratory of pharmacology, which he established in the basement of his own home. With the he funded for this laboratory at the expense from his pocket. He established world first institute of pharmacology, that is known as Rudolf Buckim Institute of Pharmacology. Oswald Schmidberg established world first pharmacology journal, along with these two pharmacologists, Clapp and Neon. And the name of that pharmacology journal was Archive for Experimental Pathology and Pharmacology. in German. Now this is known as Non-Smithberg Archive of Pharmacology. This pharmacologist first time argued for this pharmacology to be a separate, distinct discipline, a separate subject from the materia medica, pharmacy and chemistry. For the first time he argued that pharmacology should be a separate subject. With the effort of Oswald Schmidberg, he established this pharmacology as an independent discipline or independent subject based on his experimental methodology. And at this point of time, materia medica was completely obsolete. So these were the books published by these two pharmacologists, Beatrice Jor Argenmittel, and the book published by Schmidberg was Grundrisse der Argenmittel. That is, the meaning of this is Fundamentals of Pharmacology. So this was the great teacher of pharmacology who had more than 200 students, 200 publications, and their student was spread over 20 countries. So we'll discuss some of the students of the Schmidberg and their contribution in the modern pharmacology. Student of Oswald Schmidberg. First we'll see John Jacob Abel. Origin was he was an American pharmacologist. He was a student of Oswald Schmidberg. Work performed by him: isolation of epinephrine and isolation of insulin in crystalline form. Then the credit to this Jacob Abel was he was father of American pharmacology. He was the first professor of pharmacology in the United States at the University of Michigan 1891, and after 2 years he moved to Johns Hopkins University. He is also known as founder of American Society of Pharmacology and Experimental Therapeutics and Journal of PET, Journal of the Society, that is Pharmacology, Experiment and Therapeutics. He was the founder, and he was founder of Journal of Biological Chemistry, JBC. Then J.N. Langley, he was a British physiologist and pharmacologist. The work performed by him. Then Langley, he was a British physiologist and pharmacologist. In 1901, he demonstrated adrenomedullary extract which contain both epinephrine plus norepinephrine and stimulation of the sympathetic nerve. Their effect on different tissues were similar. So this was the demonstration of the Langley. One side stimulation of the sympathetic nerve and one side adrenomedullary extract, which is a combination of epinephrine and E. So on different tissues he found similar effect. In 1905 he proposed receptor theory. He showed that these different tissues, the site of action for these epinephrine and norepinephrine was a receptive substance that at present we call it receptor. So in receptor theory he proposed that the site of action for this adrenomedullary extract was receptive substance, means it was the receptor. And today we know that epinephrine they work on alpha 1, alpha 2, beta 1, beta 2, these receptors. So this was the receptor theory. He is known for the genesis of the concept of CST, that is chemical synaptic transmission. That is chemical synaptic transmission. So for these three work, Langley is known for the receptor theory and genesis of this concept and the receptive substance which was the site of action for this adrenomedullary extract, epinephrine, norepinephrine. And when he stimulated the sympathetic nerve, he found the similar effect as he used this adrenomedullary extract on different tissues. So after John Jacob Abel, the father of American pharmacology, and Langley, receptor theory and concept of receptor, the third student of this Oswald Smith was Kussne. He was the first professor of pharmacology at University College London. Then H. Mayer, along with Smithberg, he discovered glucuronic acid. Now we know glucuronic acid is very important in the metabolism phase 2 reactions of multiple drugs. Then he found one relationship between lipid solubility of general anesthetic and potency. He concluded that this lipid solubility is directly proportional to the potency. The similar conclusions were given by Overton, and together this hypothesis was known as Meyer-Overton hypothesis in the general anesthesia. After that, Otto Loewi, the student of Oswald Smithberg. Otto Loewi, he is known for the demonstration of acetylcholine is a mediator of neurotransmission. Means if there are nerves, cholinergic nerve, they release acetylcholine, which is a neurotransmitter. So this neurotransmitter function of acetylcholine was discovered by Otto Loewi, where he got Nobel Prize of 1936 along with Henry Dale. So this finish our lecture of modern pharmacology with the trick MBBS and the 5 students of the Oswald Smithberg.